Welcome. I'm Dr. Lauren Stryker, and tonight the topic is itchy vulvas. So we're going to get started with those difficult to treat yeast infections, move on to lichen sclerosis, and then talk about a lot of other things that you may not have thought about that causes that really irritating, burning, awful itching. But I want to start with the fact that when women talk about their vaginal rashes and their vaginal discharge and their vaginal itching and their vaginal pain, 99% of the time they're actually talking about their vulva, but they say vaginal. So just to be clear that we're all talking the same language, when we talk about the vulva, we're talking about everything on the outside and the vagina is on the inside. And unless you're a gynecologist and you happen to own a speculum, you cannot see your vagina. But the good news is you can see your vulva. Sometimes it's not so easy to see your vulva. We have a lot of patients that take those vulvar selfies and try and send them to us. Not recommending that you do that. But the point is that women need to know their vulvas. They need to know what's going on with their vulvas, and then they'll have a lot less trouble with itchy vulvas. So a lot of you know already, I'm the medical director of the Center for Sexual Medicine and Menopause at Northwestern. And not too long ago, we started a specific program for vulvar and vaginal health. And of course, when I started this program, I needed to find an expert in vulvar and vaginal health. And I got very, very lucky because one of the country's really incredibly well-known experts in this world, Dr. Rajat Patel, was relocating to Chicago, and I convinced her to come and join us at the center. And lucky for me, she came on board. So I'm there.
Hi.
So we both actually just got home from clinic. We both had very, very busy clinics today. The difference is I see things other than vulvas. And that's actually not true. Dr. Patel also does menopause and sexual medicine and all those other things. But she, you are the vulvar queen, right? So I know you had a busy clinic today. Of all of the people in your clinic, just like what percent would you say that their major complaint was vulvar itching?
Over half.
Over
Easily.
half. Yeah. Okay, so of the ones that you saw that came in with vulvar itching, how many of them thought that the problem was yeast versus lichen sclerosis versus they had no idea they were just coming in because they were tired of vulvar itching?
Most people thought they had yeast, and I will tell you that today I only had one patient with an actual yeast infection.
Okay, so this is actually exactly what we all experience, is that so many women come in and they say that they have recurrent yeast or they get yeast all the time. And in fact, they don't. They have something else. So why don't you kind of walk everyone through when people think they do have yeast, what's usually really going on?
So common things being common, yeast is a very common vaginitis. So a third of the time when somebody comes in with itching, this is common, okay? But in our specialty clinic, it's not common because they've already been to their PCP. They've already been to their gynecologist. They have been tested and it's been negative and they still think they have yeast. And then they come in and we diagnose something completely differently, right? But in a generalist clinic, though, it's not unreasonable to see yeast a third of the time.
Okay, but there was a study I recall that came out a number of years ago. It's not a new study, but what they did was they looked at women who'd self-diagnosed. I'm a lot older than you. I hate to admit it, but I am. And when I first started practicing, women could not go to the pharmacy and buy yeast medication. They had to go to their doctor and they had to get a diagnosis. So when women started self-diagnosing, and there was a study that came out that specifically looked at how often were women correct when they thought they had yeast, how often did they really have yeast?
Yeah. Less than 30%. Like, it depends on the study. I think the study you're talking about was 11% when they did a survey, and less than 30% when they actually looked at their cultures.
Exactly. And most of those women had bacterial vaginosis, which we're not going to talk about a lot tonight. But bacterial vaginosis is the most common vaginitis, the most common cause of abnormal discharge. And so many women, when they think they have yeast, they really have BV. But I want to back up a little bit because, we're talking about itchy vulvas, but you said vaginal yeast. So could you talk for a minute about the differentiation between a vaginal yeast infection, a vulvar yeast infection, and when yeast is going to cause an itchy vulva and when it's not?
Yeah. So You could have both, and often it does arise in the vagina and then travels to the vulva. You have to treat the vagina even if you have zero vaginal symptoms, even in the absence of discharge, even in the absence of any vaginal symptoms. So usually it's a, a pathogen that lives on your body and that has gotten out of control for various reasons.
Okay, so but just to be specific, if someone has a vulvar yeast infection, I kind of just threw out there the vulva is everything on the outside, but of course the vulva has a lot of different parts.
Right.
So there's a big difference between the woman who comes in and she says, "I'm scratching, scratching, scratching," and she's really scratching what we call the vestibule, the opening right outside the vagina,
Mm-hmm.
as opposed to the vulva where the pubic hair and her labia majora and all of that. And so it is different. I mean, when we're talking about specifically a yeast infection, you can get yeast that's
Any
just in the opening of the vagina and then
anywhere.
also anywhere
You can
except, and
get
I think,
yeast in the buttock area. You can get yeast around the anus. You can get yeast under your breasts. You can get yeast on the vulva. You can get yeast in the vagina. Anywhere.
all right, so before we start to get into the difficult to treat for the people who really do have yeast, so let's just assume for the sake of this discussion that we're only talking about people who don't have bacterial vaginosis, they don't have another vulvar condition,
Yes.
but they do have yeast.
Yes.
Why? Why do some people get yeast infections?
So a lot of factors. The risk factors for yeast infection. Diabetes is a big one, and genetics may play a really big role.
Genetics. Now, so that's interesting. So if your mom had yeast infections, you're going to have yeast infections?
There was a study that was done, not in America, but that certain people who have recurrent yeast infections carry a gene. So they're actually in the research working on a vaccine, perhaps, that could help. So it
That
could
would
be
be cool.
genetic,
That is very
right?
cool. Okay, so but there's all these ideas that okay, for so where does people have yeast that lives normally in the body? Where is it okay to have yeast?
When you don't have symptoms. So
Yeah,
if you were to have, I never do a culture if the patient doesn't have symptoms. But if you
right.
were to culture, and they have done this before, if you were to culture women and take a look at what their flora, vaginal flora is, up to 20% of them may have candida, which is a species of yeast, just as a normal part of their vaginal flora that's
Right. So
supposed
the
to be
fact that
there.
someone has yeast is not when people have yeast in their gastrointestinal tract.
Yes,
They have yeast that lives on the skin. They have yeast that lives in the vagina.
yes, and that's
And
normal.
the presence of yeast is not the problem. It's
Correct.
when the yeast go, "Oh my God, I'm going to take over the whole neighborhood,"
Yes,
and
exactly.
and then get these crazy crazy symptoms. Okay, so when we talk about again, so we talk about why some people get yeast. I think the thing that's very often frustrating for us who are treating women all the time, there's so many myths out there about what causes yeast infections and what doesn't cause yeast infection. My favorite myth that I get all the time is women will come in and say, "I'm wearing my cotton underwear and I never sit in a wet bathing suit." And I'm like, whoa, 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 whoa. None of those things have ever been shown to be the reason why people
Yes,
get yeast. And they're like, "Are
right.
you kidding? Wet bathing suit?" I was always told, "Don't sit in a wet bathing suit." And my answer always is, "Do you think Olympic swimmers have more yeast infections than other people?" No, they do not. The
Right.
wet bathing suit doesn't make any
No.
difference. What's your favorite myth? That's mine.
Um, my favorite myth is if I eat yogurt, I can avoid the yeast infection, or if I take a probiotic, then the yeast infection will get better.
Okay, while you're on the topic of yogurt, I just want to tell you, and by the way, if anyone has any questions, put it in the stream and we will try and get to all of them. I can see your questions coming in from Facebook, so please, feel free to put them in. So the yogurt thing, on my website, drstryker.com, and I have a lot of articles, and the most popular article, the number one article is putting yogurt on a tampon, because you're talking about eating yogurt, but then there's putting the yogurt in the vagina. And so in my article, I go through all the articles and say, don't do this. This really hasn't been shown to help. People are like angry. They're vicious. They're like, "No, no, no. I put yogurt in my vagina all the time and it works fine and it wipes out my infection." So what do you tell people who tell you that they're going to put
Per-
yogurt in their vagina?
Perhaps it's the cooling factor when they take yogurt out of their fridge and put it in their vagina and it feels better. Um, and it's not that your body can't treat its own infections. Sometimes your body can clear an infection on its own without having treatment, because that's what your immune system is for. So
Yeah.
they've done studies on this, and yogurt is not helpful for yeast.
Right,
And
right. And I think the point that you made is really the important part is that a lot of times it will go away on its own. Our
Yes.
bodies are usually pretty smart, and they'll kick in and get rid of an overpopulation. So I think sometimes, obviously if someone's uncomfortable, we don't want them to stay uncomfortable. We want to treat it.
Right.
But a lot of times it will go away on its own, which is why people think that some of these remedies that don't work really do work. Okay, so let's talk about for a minute the woman who comes in, because as we see the difficult cases, we don't see the people that just treat it and it goes
Right.
away, right?
Right.
So talk us through, a woman comes to clinic to see you, and she is truly one of those women who is getting recurrent true yeast infections every time she turns around. She's got another yeast infection.
Mm-hmm.
So first of all, what kind of tests do you do for that woman? And then we'll talk a little bit about how you treat that.
Sure. First of all, I need to figure out, does she fit into the category of complicated yeast infections, right? Instead of the simple yeast infection. So if she's pregnant, if she's immunosuppressed, if she has HIV, if she's had 4 or more yeast infections in the year, 3 or more actually now, then she qualifies as having a complicated yeast infection.
Okay, so when she comes in the door, there she is,
Telling
feet up
the
in the
story.
stirrups.
Yes.
What are you going to do?
After I've reviewed her history and made sure that these yeast infections are actually proven.
Yes, proven.
Yes.
Absolutely, this poor woman
Yes.
is getting yeast every 2 months.
Yes. So I'm going to do a very thorough exam. I'm going to look for other dermatoses. For example, lichen sclerosis, which we'll talk about later. You can have superimposed yeast. I'll do a thorough exam, and I'll do a culture. I want to find out what kind of yeast it is. Because everybody thinks it's Candida albicans, which is in 80 to 90% of the time it is Candida albicans. But many times you can have yeast that's different. You can have glabrata yeast, or you could have Crusay yeast, and those are treated differently, and they could be resistant to fluconazole.
And just to be clear, so when a woman goes to a gynecologist, because people are like, well, no, I go to my gynecologist and they do all these swabs and cultures and everything all the time.
Yes.
And the truth is that in most cases, when a doctor is checking for yeast, they're not doing a culture. They're doing a
Correct.
swab. They might be looking under the microscope for yeast. They might be doing one of these quick tests. And there's nothing wrong with that if someone has garden variety yeast. But we're again talking about the woman who's coming in who says, I keep getting treated, it's not getting better. And what you're saying is those are the women that would benefit from an actual yeast culture. Now,
Yes.
A lot of people will say, well, how do I know? How do I know if I've, been cultured? And the answer is, if they tell you your result in 24 hours, you did not have a culture.
It's going to be a few days.
How long does it take for those cultures to come back?
Up to 3 days.
Yeah.
And then longer. Sometimes they grow it for longer, depending on the species of yeast.
Yeah, I've had it I don't get a result for even 7, 8, 9, 10 days,
Mm-hmm.
which can be really frustrating for someone who's been dealing with this. So let's just say that so someone comes in and they have a culture, and when you do these cultures, like when some people have a urine infection and they bacteria, we're always looking for sensitivities, for antibiotic sensitivity, so we know which antibiotic to give them, right?
Right.
But when someone has a yeast culture, which is a fungus, not a bacteria, are you also doing antibiotic sensitivities for those women?
I'm generally not, because I can tell by the species what is going to help them. And if that doesn't help them, then I'll think about doing a testing to see what the yeast responds to.
So when we talk about what's going to help them, okay, so let's start, with what helps and what doesn't help. Okay, so when women go to the pharmacy, and because people do this, of course, before they come to the doctor, they do the over-the-counter remedies. So can you talk a little bit about the over-the-counter remedies, which ones are reasonable to try and which ones should be avoided?
Absolutely. So when over-the-counter treatments, without looking at the brand names, just looking at what the actual medication is, you're going to have miconazole, you're going to have clotrimazole. So those are the most common ones that you'll see over the counter.
And I know you don't want to do this, but tell us the trade names, because people don't know those words, but they do know trade names.
The Monistat, that's your big one.
Exactly.
Yes.
We don't work for Monistat. We're just
I promise we don't.
Information.
So Monistat 1 day sometimes has a different type of medications. So I would not recommend using the 1 day, but the 3 day, 5 day, 7 day, those are all okay to use. And, they've actually studied this, and what works better, to have a prescription from your doctor for an oral medication, or to get something over the counter like miconazole or clotrimazole, or even a prescription for something that is topical. They are equal.
Okay, but let me ask you this. So, we're talking about vulvar itching and vulvar yeast as opposed to strictly vaginal yeast. So if someone has a yeast infection, and they get a suppository or a cream, should they be putting it just in the vagina, or should they also be applying a cream to the vulva?
Applying to the vulva as well, because that's what's
Yes,
going to
I
give
think
them
that's really
relief.
important because, we see this so often in other things that we treat, like vaginal dryness and stuff that we're not
Right.
going to get into tonight. That one of the things that we see that with a lot of failures is people are being told to treat inside the vagina. And I always say the poor forgotten vulva, no one's paying any
Right.
attention to the vulva, and
Right.
you really have to treat both. So, but nobody wants to use creams and suppositories. Everybody wants diflucan, right? Like
Which is
fluconazole.
okay.
Everybody wants the pill.
Right.
So they either call us and say, "Can you prescribe the pill?" or they come in and they ask for the pill. So can you talk a little bit about, and the pill for those? I mean, I'm talking about a pill in the mouth, not a pill in the vagina.
Right.
Those of you out there who aren't, taking this stuff a lot. How often does diflucan pills work, and why would they not work?
Diflucan is very good for your garden variety yeast. It's very, very good. Candida albicans is not usually resistant to it. So for the most part, it works very well. Some of the common side effects, though, so why somebody might pick something vaginal or topical over the fluconazole. Fluconazole is systemic. It goes through your whole system, goes through your blood. So some people may have GI disturbances. They may have stomach issues from it. They may get a rash from it. And for that reason. But the convenience factor is usually
It's
what
huge.
drives, yeah.
And some people are allergic. It's a class of drugs called the azoles, and some people have true allergies.
So actually, there's a new drug out there.
There's a new drug. I
Yeah.
was some of you I know were watching on WGN News today that I talked about Brevafemme, and normally I don't use trade names I cannot pronounce. Ibrexafungerp or something. Can you say it? I can't really say it. It's this
No,
crazy name.
not
Anyway,
going to try.
and again, and I always make this point, we don't work for these people. We don't get paid for these people. We're just telling you what's out there. But there is a new oral drug called Brexafemme, and it's a one-day treatment like diflucan. The difference is diflucan's only one pill. Brexafemme, it's two pills that you take twice a day, but it is one day. And it's really for those people that are either allergic to diflucan or people that it's resistant. There are, it's not a high number, but we do know that there are some people that are resistant to diflucan. But let me ask you this, Dr. Patel. So if we're talking about people who have recurrent infections, okay? So if somebody takes their diflucan and then it comes back again,
Yes.
and again and again and again, how do you wipe out?
So-
Let's just say they tolerate all the medications.
Sure.
How do you wipe out that recurrent infection?
So this is where the culture is very important. First of all, does the yeast respond to fluconazole? If it's the type of yeast that doesn't, it's not going to work and you're wasting your time. Let's say that it is a type of yeast that responds to fluconazole, but they, because of their circumstances, they're immunosuppressed, they have uncontrolled diabetes, or they have this genetic factor, then I will put them on suppression. So I'll actually treat them very aggressively for the yeast and then put them on suppression with fluconazole for a whole 6 months.
And how do you do that? How often do they take it?
Once a week.
Once a week.
Fluconazole once a week.
Yeah. One of the things, and we see a lot of other people who've been treated by other doctors, and it's not uncommon that someone will come in and they're taking a fluconazole every single day, which is not the way to do it. First of all, it's not going to be helpful, but also it lasts about 3 days in your system.
Right. So you have to know how the drug works and the pharmacology. So the pharmacokinetics of this drug is that the half-life is very long. So it's going to stay in your system pretty long. And if you're taking this drug more often than prescribed, it can have some serious issues, liver problems, for example.
Yeah. So I think, that the major take-home message here, and there's a lot more we could talk about with yeast, but we want to get to other stuff too, is that it can be extremely frustrating. Number one, we know that. Number two,
Yes.
A lot of times that people think it's yeast, it's not yeast.
Yes.
And number three, if your own doctor isn't helping you, they could be a very good doctor, but they may not be an expert in this, and you need to see an expert. There's a question that came in from Angie Cummings that says, are there any specialists in the Chicagoland area that treat vulvar itching? This would be the specialist. And I forgot to put that up. Dr. Patel's statement also, and I just want to remind everybody that if they would like to come to see us here in Chicago, we are at the Center for Sexual Medicine and Menopause, sexmedmenopause.nm.org. And if anyone has any questions about that, happy to do that as well. But anyway, thank all of you for coming in. This is where send me your suggestions of other things that you would like us to talk about, other Facebook Lives. We do a lot of these. We've got a lot more coming up. So thank you for joining. Thank you for your questions. And if you want to stick around for a minute, then you will hear the theme song, the Francie theme song, which is from my books, which I did not talk about tonight, but my book, Slip Sliding Away, Turning Back the Clock on Your
Great.
Vagina.
It's fantastic.
I think it's a must read, and that came out last month. Next month is Hot Flash Hell, a gynecologist's guide to turning down the heat. After that is my book on finding your mojo, specifically orgasm after menopause. So keep them coming. We have a lot of fun things coming out, and this song that you're about to hear is the Francie theme song. Francie is my character that is throughout all of my books. She represents all menopause women everywhere. And yes, this song was composed and performed by my husband, who is a producer, singer, songwriter. You didn't know that. And the famous Megan McDonough. So enjoy, and thank you all.
Found a friend who understands the flashes and the feeling dry as sand. My body was on pause, it wasn't taking calls. Then Francie took me by the hand. She told me all these things that I can do, that sometimes I feel blue. She helped me see the light. Now I'm sleeping through the night. I